Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Hi guys, we are from Group 5. We would like to explain about our journal. Our journal is about diarrhea. The member of our group are Siti Rukoya, Reni Skiawati, Rizka Maulina, Widya Okta, and Suci Nuraini. The first journal will explain by Siti Rukoya.
Okay, on the first slide, there is a theme article, antibiotic for the empirical treatment of acute infection diarrhea in children. Next. Okay, what is acute diarrhea? Acute diarrhea is the common infection disease in developed country, mostly affecting children younger than 5 years old. Acute diarrhea remains one of the most important health issues worldwide, with high morbidity and mortality rates, accounting for more than 2 million deaths annually. What cause of acute diarrhea? Caused by virus such as rotavirus and enteric adenovirus, and then to be mild and self-limiting with optimal treatment consisting only of oral rehydration and nutritional support outpatient parties or the emergency room.
And then treatment. A few cases, however, may require antimicrobial therapy. Because of the severity of the clinical picture or a patient increased potential to develop complications such as dissemination of the disease, sepsis, or disseminated intravascular coagulation. And antimicrobial treatment tend to quicken the clinical resolution of diarrhea, prevent the progression of disease, and reduce the severity of associated symptoms such as fever, abdominal pain, and vomiting.
An argument about diarrhea. On the other hand, there are several arguments against the empirical use of antibiotics for acute infections diarrhea. The most compelling of them is the fact that acute infectious diarrhea is typically a self-limiting disease, regardless of its etiology, with most cases resolving in less than 3 days. Moreover, one must consider the low incidence of treatable pathogens among the causative agents of acute diarrhea, which are virus in most cases. The possible occurrence of side effect, the potential development of resistant strains, the cost of treatment, and a possible noxious effect on the disease itself. Disadvantage of antimicrobial use. The most severe drawback of widespread use of antimicrobials for the treatment of infectious diarrhea is the consequently rising rates of antimicrobial resistance fostered by the unselected use of this drug in patients with a mild presentation, with low risk for complications or who would recover well without antibiotic. This finding demonstrates the important role of doctor when they prescribe this drug, especially to outpatients. And these are some examples of antibiotic drugs used for diarrhea. There are ampicillin and trimethoprim sulfamethoxazole, chloramphenicol, tetracycline, fluoroquinolones, nalidixic acid, third generation cephalosporin, azithromycin and erythromycin, metronidazole, and probiotic.
Okay, that's about the first journal. And next, second journal. The title from the second journal is Infectious Diarrhea, when to test the and when to treat. Infectious diarrhea, when to test and when to treat. First, what factors are important on history and examination? The initial assessment of anyone presenting with infection diarrhea should focus on severity, need for hydration, and historical clues as to the cause in the patient. And two, who requires testing? Because most instances of acute diarrhea are self-limiting, and because the diagnosis yield of stool culture is relatively low, testing everyone who presents with infectious diarrhea is not necessary. Third, three, what treatment should be offered? A. Supportive treatment. Treatment is oral hydration. The World Health Organization has laid out clear guidelines regarding the composition of effective oral rehydration solution. Each alternatively, a combination of water, fruit juice, and salted crackers or soup may help replace fluid and electrolytes in patients with mild dehydration.
Then number 3, part B, pathogen direct treatment. Because result of stool culture can take 48 hours. The treating physician needs to decide whether empirical treatment is required before confirming the diagnosis. Number 4, how can transmission be prevented? Although infectious diarrhea is often associated with food-borne illness, mild pathogens such as norovirus or Shigella can be readily transmitted person to person. Patients who have acute gastro, gastrointestinal illness should be reminded of the importance of hand hygiene as a way to prevent transmission to others. And the last, when should public health official be notified? Acute gastrointestinal illness is underreported to public health officials. Recent data from the National Studies on acute gastrointestinal illness suggests that for every patient with teratogenic A.
Okay, that's all for our group. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.